All right, so rapid fire second. What are the potential benefits? I'd like to, if you can enumerate one or two benefits to each of the parties, or if you think like you can't figure out why this one's going in. Somebody, go for it.
The PBM payer relationship and the ability to manage a cross benefit was one really quick one.
So I was struggling a bit with that because when I first started coming out one after another, and I'm thinking, but these PBMs have multiple payers, and there was always that concern. When you make those alignments, are you casting off all these others who are potential clients because now you're in bed with one? And that was a struggle for me understanding the PBM logic. Anybody got a response to that?
Well, actually, I would add on to that I'm still trying to figure out where in the value chain the PBMs add value, and whether ultimately that's a business model that is going to be sustainable.
And that's why it was a great move for Express to go to Cigna, because they secured their future.
Absolutely right.
They lost Anthem.
They did not see, I think, a future in which they were going to have a growth, the potential to have multiple different clients.
So you've worked on the payer side, and I would argue that you could argue the PBMs were the only adult in the room. Somebody had to say no. The payers weren't going to do it in-house, so they outsourced it to somebody who could say no, and that was the role that they were serving.
Yeah, so again, when I worked at Aetna, CVS was our preferred pharmacy provider. They were not, obviously they were independent. Coordination of benefits was a nightmare. Getting medical policy to match up was always challenging. Deciding who was responsible for what was always an issue. And CVS would sell against a comprehensive health benefit that Aetna was offering. So they would literally, in the morning, have meetings together, and then in the afternoon go to basically the same self-insured plan sponsor and sell against one another. So I think, I do think that it allows the strengths of both to complement each other. Of course, Anthem is building their own PBM now. Cigna was the only one who really didn't have their own PBM. CVS now, of course, with the Aetna thing going through, will have the integrated thing. To me, it's a safe move. It's not a particularly innovative move.
It's a good segue, because the next question is: are there any innovations that you foresee coming out of these mergers?
Well, I'm watching what United and Optum are doing with great interest, because when you look at an organization that has vertically integrated and you look at all the building blocks they have put together, I mean, they're now in data analytics, they're in advisory services, they're in pop health, they're in ambulatory surgery, they're the largest employer of physicians in the country. They've surpassed Kaiser with their DaVita acquisition. And now, of course, they're a huge payer. The question is, how do you put all those building blocks together? I'm sure they're scratching their heads trying to figure it out, but that to me is fascinating.
I've heard rumors that they're not going to be in the payer business that much longer.
And they may be true.
I actually love both the Aetna CVS and Humana Walmart deals, and I'll tell you why. So there's two models in which I think they're interesting. How many times have you had a kid have an earache and the pediatrician couldn't see you? How many times did your wife or daughter have a UTI and the doctor's office was closed? By getting primary care closer to the consumers of primary care, it will massively improve the efficiency of the delivery model. Now, that could happen with Teladoc too. I'm not saying it's the only solution, but I'm just saying. You got your Walmart Supercenter open 24 hours a day. They got a walk-in clinic. They're very efficient, a heck of a lot cheaper than going to the doctor's office.
And the utilization of antibiotics is 60% inappropriate.
And it's no different than everybody else. So let's not point fingers. Right?
And it's Humana, and Humana is huge Medicare Advantage.
Yeah.
And think about who goes into your Walmart stores. So I agree.
Now let's
I think
talk
that
about,
one's very logical.
Let's talk about
Good voices are coming up. This is what I love.
Let's talk about chronic disease management. Fascinating idea. So that's where all the money's spent, right? Most of the money is spent on people with a lot of medical problems. All right. So let's say you made it easier for a diabetic patient to meet with a nutrition person. Now, I don't know about you, but in my practice, having a nutritionist on site to visit with my patients was impossible. Here, we've got Walmart. Walmart's got the diabetic specialist, nutritionist, there in the Walmart store. You go to do your grocery shopping, hint, hint, right? Social determinants of health, diabetic counts. Just think about the ability to form a stickiness with people with chronic disease. Hop on the scale, Mrs. Congestive Heart Failure. Let's see how you're doing. Oh, that Campbell's soup you got there, and that's not going to work so good. Why don't we find something? It's just really cool to think about how we could change the chronic care delivery model in a consumer-friendly way, in a way that people are comfortable doing. And I think that would be amazing.
And not just the brick and mortar aspect of it, but what we were talking about earlier as well is the data aspect. To be able to manage patients, pull up an app, have alerts, have whatever it is that they need in order to manage a chronic patient would be.
But that's going to happen because Walmart has deep enough pockets to make that happen where it never would have happened if it was just on the payer side?
Walmart, Amazon, Google, whoever's getting into this space
Right.
is going to make this happen. Apple, I think Apple has plans to actually put some clinics out there, so I think that it will happen.
And let's remember, traditional health plans are conservative organizations. Aetna or Humana, they would never, ever do this on
Right.
their own.
That's
The
why this
idea
is
of a
disruptive.
partnership, it's interesting because the partnership, although it doesn't sound like it's complementary, that's what people say when they see my wife and I together. What's the attraction? The truth of the matter is that they really are complementary. They really are complementary, right? It's all about taking a really innovative, customer-friendly, consumer-facing organization and marrying it to somebody who knows something about how to deliver health care.
Absolutely.
And then, given the fact that there's a payer in this mix, they can leverage their networks in terms of continuity of care with specialty care and with inpatient care to have this seamless network, but the portal of entry being the primary care and the chronic disease management, as you so well said.